Acid causes cavities. Surprisingly, I ask a lot of patients, do you know what causes cavities? And they'll say things like, well, they'll say they don't know, or they'll say sugary foods, or not brushing your teeth, not flossing. And while all those things are true, really it's the acid that breaks the tooth down. So if you don't brush your teeth, you have bacteria on your teeth, and that leads to acid. Or if you drink sodas, they have acid in them. And if you eat sugary things, it all leads to decay, but it is by way of acid. So it's important to understand what are the sources of acid. One source is if you have acid reflux, so if you have acid that comes up from your stomach to your mouth, that's one source of acid. Another source are acidic things that you put in your mouth, so drinks that are sometimes candies that are acidic themselves, those will break down tooth structure. And then also sugars, simple sugars, which would be in your candies, cough drops, mints, chewing gum with sugar in them, but also breads, those sort of things can also break down to more simple sugars that will feed the bacteria on your teeth, and the bacteria will eat the sugar, make acid, and that acid will dissolve your enamel. So it's important to understand those things. The pH scale, just to explain that, the pH scale goes from 0 to 14, with 7 being neutral. So your body typically should be around 7, not acidic, not basic. Basic is above 7. But anywhere below 5.5 on the pH scale is where tooth breakdown starts to occur. So anything you drink, any sodas, commercially available drinks, if you Google or just internet search the pH of that drink, you'll get a pH. It'll show you the pH level. So, for instance, energy drinks are below 3. So that's about the pH of your stomach. And your stomach is designed to break things down to aid in digestion. So if you're exposing your teeth to those things, you can certainly put yourself at higher risk for cavities. And then the way sugar works as far as causing cavities is sugar in the presence of bacteria, which we always have a thin film of bacteria on our teeth, but if you have areas that you don't brush or floss very well, the bacteria will build up, and that bacteria will eat the sugar, and that will make acid, and then the acid will break the teeth down. Sometimes we have patients who don't brush along the gum line very well, and then they'll have white spots, which are the initial starting of the cavity, and then they'll have brown spots, which are the cavities. And then particularly without floss, when you're not flossing and then you are eating a lot of sugar or acidic things, below where the teeth touch or below the contact, if that area is not cleaned, then the bacteria will build up there, eat the sugar, and make acid. So to recap, acid causes cavities, and you just have to, and I give this talk all the time to patients every day to help them need less dentistry and have less problems. But you just have to be aware. You have to analyze your own diet, and it's all about frequency of exposure. So if you're awake for 16 hours in a day, and when you put acid on your teeth, it takes your saliva about 30 minutes to buffer or dilute that acid away and protect your teeth again. So if every 30 minutes throughout the day you're sipping or snacking on something with sugar or acid in it, you're exposing your teeth to acid, you're holding the pH level in your mouth low, and you're increasing your risk for cavities. So you have to be aware of that, and you have to make sure you're effectively removing the plaque from your teeth, and then you're not providing a source of acid to cause damage to your teeth. And the better you can balance that and keep the pH higher in your mouth, the less chance that you're going to need fillings, extractions, root canals, all the things that I do from our patients every day, but so much of it can be avoided with proper diet and proper care. One more thing to touch on is that that saliva plays an important part in protecting your teeth from cavities. The saliva, number one, it dilutes the acid away. That's one thing that it does. But then it also remineralizes your teeth. So sometimes your teeth will start to break down a little bit, but then your saliva comes in and has things in it that will remineralize the tooth. So keep that in mind. If you start to get dry mouth, you definitely want to let your dentist know. And what you don't want to do is to treat your dry mouth with things with sugar in it or acidic things. And again, you can do an internet search. Some, even sugar-free cough drops, sometimes themselves are acidic. So you want to look out for sucking on those things, keeping those things in your mouth, because that provides a steady source of acid or sugar to the bacteria, which makes acid, and that will break down your teeth. A lot of times we'll have patients come in and they haven't been having problems. We've been seeing them for a long time, and then suddenly they have problems. And a lot of times it's because they either just picked up a new habit of, drinking something acidic or having sugary things. But a lot of times they'll have dry mouth and then they'll start sucking on cough drops or mints. And the combination of that sugar on the bacteria without saliva rapidly accelerates the demineralization and the cavity process. So you always want to just keep that in mind. If you have any changes in your saliva, let your dentist know. And then one other thing you can do is, well, there are many things you could do, but one more thing that you could do is a fluoride rinse. We recommend ACT fluoride rinse. Any fluoride rinse would probably be fine. But what the fluoride does, is when you rinse with it, it incorporates itself into the enamel, and it makes the enamel harder, or it makes it more resistant to acid. So you have to actually have a little bit lower pH to cause cavities in teeth that are protected with fluoride. So if you have any questions, just let me know or let your dentist know. And I wanted to get this out there. This is important information. If you embrace this information, you look into it, then you'll lower your chance of risk for cavities, or your family members' risk for cavities, and you'll live a better life with less trips in my chair. Thank you.